Good afternoon. My name is Rebecca Ladd, and on behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. As a reminder, following this broadcast, we'll be copying any prepared statements into our Facebook Live and YouTube Live feeds. We appreciate your patience as we do this. If you are joining us on Facebook or YouTube and have a question that you'd like us to address, please feel free to leave that in the comments section. If time allows, we will do our best to answer that question on air. If we are unable to do so, we will respond to you following the broadcast online. We would like to thank everyone for their outpouring of support at our PPE donation center. While we have received many donations, our first responders and medical personnel are still running critically low on the life-saving supplies they need to continue protecting our community. Please, if you have any PPE, such as face shields, nitrile gloves, gowns, or masks, consider donating to those on the front lines. Our donation center is located at the Mills Police Department at 4800 West Yellowstone. It is open from 9 a.m. to 4 p.m. Monday through Friday. If you have any questions or concerns, please call 307-439-1248. We are also requesting any empty hand sanitizer bottles to be refilled and redistributed. Thank you so much for your support. As a reminder, anyone who is still using personal protective equipment outside of first responders and medical professionals, please be mindful. There is a critical shortage across the nation. The EOC, as well as first responders and medical facilities, are doing everything we can to conserve PPE. Every piece is valuable and is needed to save lives. Today, we are very excited to announce the launch of the Natrona County Emergency Operations Center website. For those of us living in Natrona County, this is our one-stop shop for local information and resources in regard to our COVID-19 response. You can visit the website at any time from your desktop or mobile device at natrona.info. That's natrona.info. Lastly, our partners at Wyoming Food Bank of the Rockies are working around the clock to serve our community during this crisis. Due to the current increased need, the food bank needs volunteers to help them pack food boxes at their Evansville warehouse. These food boxes will go throughout the state to fight hunger. Volunteers can choose from 2 different shifts that are offered Monday through Friday. The morning shift begins at 8 a.m. and the afternoon shift begins at 12:30 p.m. There is also an opportunity to help tomorrow, March 28th, from 9 a.m. to noon. Their goal is to ensure everyone who needs food gets it. If you are interested in volunteering, please contact Ashley Nicolai at 307-232-4016, or you can sign up to help online at wyomingfoodbank.org/volunteers. Thank you.
Good afternoon. I'm Christy Bleisefer with Wyoming Medical Center. Wyoming Medical Center, along with our dedicated partners, are overwhelmed with the outpouring of support from this community, and we are humbled to accept your generous offers to help. Wyoming Medical Center faces the same shortages in personal protective gear as other hospitals and first responder agencies across the country in this unprecedented health crisis. We are preparing now for those shortages and making plans to conserve the PPE we have. We know that many individuals and groups have been sewing face masks, isolation gowns, surgical masks, and other PPE, and we greatly appreciate these efforts. Our biggest needs right now are for isolation gowns to protect staff treating infectious patients. We have partnered with Loretta Miller of Mountain View Baptist Church to organize community volunteers to help with this effort. And Loretta has patterns approved for our purposes. Email her at polar.ice2712@yahoo.com to join the group. We are also accepting donations of cloth masks, caps, and surgical masks. Donations can be made to our Sky Lobby in the McMurray West Tower, accessible from the West Parking Garage, or at the Mills Police Department between the hours of 9 a.m. to 4 p.m., Monday through Friday, and they will be distributed to agencies in need. Approved patterns for homemade PPE and full details can be found on our website, wyomingmedicalcenter.org. Wyoming Medical Center is also asking pregnant women 20 weeks along or further to call ahead before coming to the hospital for treatment of any kind. This will allow us to do a phone screening for risk factors and help to ensure your safety upon arrival at the hospital. The number to call is 307-577-5530. Thank you for your cooperation and your patience as we work to protect our staff, our community, and each other. Thank you very much.
Good afternoon. I'm Haley Bloom with the Casper-Natrona County Health Department. Thank you for joining us today and for your assistance in providing and disseminating up-to-date factual information surrounding coronavirus, otherwise known as COVID-19. Yesterday evening and this morning, the Casper-Natrona County Health Department received confirmation from the Wyoming Department of Health Public Health Laboratory of 2 additional positive cases of COVID-19 in Natrona County. This brings our Natrona County case count to 8, and statewide there are 70. The 2 new Natrona County positive cases from last night and today are not believed to be connected to the other 6 cases. The exposure of these individuals is currently unknown. Currently, the Wyoming Department of Health is working on contact tracing for these individuals. The 2 individuals have been contacted by the Wyoming Department of Health and have been advised to self-quarantine. In the coming days, the Wyoming Department of Health will make contact with anyone who is potentially exposed and possibly at risk of illness. As soon as we at the local level receive more information on the positive cases from the state, we will share that information. Here's what we know so far. Case number 1 is a female in her 50s whose exposure is believed to be connected to travel within the state. Case number 2 is a male in his 50s whose exposure is believed to be connected to international travel. Case number 3 is a male in his 60s who is believed to have been exposed to another positive case. Case number 4 is a female in her 50s who is believed to have also been exposed to another positive case. Case number 5 is a female in her 80s whose exposure is believed to be connected to international travel. Case number 6 is a female in her 60s whose exposure is believed to be connected to international travel. Case number 7 is a male in his 50s whose exposure is currently unknown.
Case number 8 is a female in her 20s whose exposure is also currently unknown. In total, there have been 177 tests performed in Natrona County between the two main testing facilities of Wyoming Medical Center and the Casper-Natrona County Health Department. Of that 177, 135 were confirmed negative, 8 have been confirmed positive, and we are still pending results of 36 tests. Results from the Wyoming Department of Health Public Health Laboratory are still taking between 1 to 3 days to be returned. We are seeing more and more positive results within the community and within the state. From what we have seen statistically in other countries and within our own, as case numbers continue to climb, there is more and more likelihood of transmission. We believe both increased testing and increasing numbers of disease are equally responsible for this. As we mentioned Wednesday, the state of Wyoming received additional test kits. Of those 2,650 received by the state, 270 of those test kits were delivered to the Casper-Natrona County Health Department yesterday, with more requested. The Wyoming Medical Center and the Casper-Natrona County Health Department are still following screening guidelines and criteria from the CDC and Wyoming Department of Health to prioritize testing. Medical professionals are reviewing the criteria daily and making adjustments as necessary. We are working hard to increase the capacity for testing within Natrona County and are making progress daily. Currently, we are facilitating testing outside of the department in high-risk populations, such as nursing homes and assisted living facilities, so that these individuals can continue to be safe in self-isolation. We understand that people are feeling many effects from the business restrictions and statewide orders. However, at this time, due to the evolving and increasing number of state cases within the state, the Natrona County health officers will not be granting or evaluating any exceptions to the orders until at least the end of the continuation of the statewide orders on April 17th, 2020. The Casper-Natrona County Health Department hotline and the Wyoming Medical Center Respiratory Clinic are still the recommended resources for those experiencing symptoms. The hotline number is 577-9892 and is operating Monday through Friday from 8 a.m. to 5 p.m. Please call ahead prior to arriving at any healthcare facility so that appropriate precautions can be taken. We do not want citizens self-reporting to the emergency room. If you're experiencing significant shortness of breath, please call 911. Due to an increase in call volume, if you need help with information, events, or things unrelated to symptoms, you may contact us at COVID, COVID, at cnchd.org. We are responding to all emails as quickly as we can. Thank you.
Hello, my name is Eric Nelson, and I am the Natrona County Attorney. This afternoon, the Wyoming State Health Officer, Dr. Alexia Harris, issued a statewide continuation of the 3 statewide health orders previously issued by her. The continuation now places the orders in effect through Friday, April 17th, 2020. These health orders require curbside or delivery for restaurants, cancellation of any events or gatherings over 10 people, and closure of specific businesses such as entertainment venues, salons, massage therapy establishments, and tattoo shops. This also applies to school closures through that date. The continuation states that schools without exception shall not recommence until April 20th. You can read full copies of the new continuing orders on our website at natrona.info. Thank you.
Good afternoon. My name is Steve Friel, and I serve as the mayor of the city of Casper. Standing with me today is Anna Kinder, Executive Director of the Casper Natrona County Health Department, and Brooke Kaufman, Natrona County Commissioner. Over the last 15 days, leaders from our community, to include county health officers, county health officials, county commissioners, mayors of all surrounding communities, Wyoming Medical Center, Natrona County School District, the Natrona County Emergency Operations Center, and many others have come together for one single purpose: to protect you and your family and to get our community through this crisis. Collectively, we have been trying to delicately balance the health and economic vitality of our community during this challenging time. This virus does not discriminate. It doesn't care about your age, ethnicity, whether you are a man, woman, or child. The youngest victim to contract this virus in the United States at this time is 3 weeks old, as reported yesterday by Fox News. The state of Louisiana has reported the youngest death as a result of this virus to be 17 years old. The most insidious thing about this virus is that you do not know when you have been infected until it is too late. Waiting for signs and symptoms of the virus before you decide to be precautious is too late. We are still seeing areas of our community where people continue to congregate, which has sadly led to the closure of areas such as our school playgrounds. By choosing not to follow orders and social distancing guidelines, this virus will spread rapidly in our community. At that point, we will be forced to consider more stringent closures and lockdown orders, as we are seeing happen in our neighboring states of Montana, Idaho, and Colorado. Restricting the areas that we can travel from our homes will be the only means we have left to ensure the virus runs out of people to infect. As the leaders of our community, we urge you to follow the orders and guidance that has been given. Wash your hands and please stay at home. While we continue to navigate through this pandemic, we understand that having additional items in your pantry may feel like a symbol of safety. We also understand that during uncertain times, we tend to focus on something that brings us certainty. That includes doing something that gives us a perceived sense of control, like stocking up on supplies. The Center for Disease Control and Prevention recommends consumers have 2 weeks of supplies. The idea is to have enough supplies to carry you through without making unnecessary trips to the store, but not so much that we're potentially affecting other people's ability to prepare too. In many organizations and across our local government, residents are reaching out and telling us they are unable to get the items and supplies they need to function in their everyday life. In our community, we can do better. Right now, we need to do better. We must pull together and help each other during this time. I'm asking you to think about your friends, neighbors, and our entire community. If we are all mindful and think of others during this crisis, we can stop this and help ensure we all have what we need. The only way we are going to be able to protect our community through this pandemic is to do it together. Whether you're a healthcare worker on the front lines or a mother with a house full of children home from school, we want to say thank you. At this time, we will now take any questions from anyone. Okay, thank you.
This concludes today's Natrona County Emergency Operations Center COVID-19 Response News Brief. As a reminder, we now have a website where you can find local resources and information from the EOC. That address again is natrona.info. Thank you for joining us. Our next news brief will be on Monday, March 30th at 3 p.m. Until then, please keep your family and yourself safe. Thank you.